Evening. Welcome to this session, which is the plenary session 4 or 6, titled uh, Preventive, Precision, Personalized, and Emergency Medicine. We have a very distinguished panel of experts on this session. Professor Y.K. Gupta, President of All India Institute, Bhopal. Dr. Sergey Sukov, Professor in Medicine and Immunology, for joining us from Russia. Dr. JLN Shastri, who is the Chief Executive Officer, Ministry of Ayush. Lieutenant General Nardeep, Director and Commandant of AFMC Pune. Dr. Chandrika Kambam, Group Medical Director, HCG Group of Hospitals. And Dr. Farid Mina, Professor, Director, and Independent Consultant, joining us from California Innovations Corporation, California, USA. Thank you, ladies and gentlemen, for being on the panel. And over the next 1 hour, I'm sure the participants will have a lot to learn, and especially on the new trends and what's happening in the changing environment. I would like to set the stage and then request each of the panelists to take it forward. Healthcare is changing, and all of us have seen, and it is poised to change further and change in a big way. All of us agree to this. But I would put this change into 5 Ps, as I call them, the 5 Ps. The first P is the preventive healthcare. I think we are rapidly moving towards preventive health movement, as I would want to call it, because we now understand that a vast majority of deaths, over at least in India, over 65% of deaths are due to non-communicable diseases, and these happen in younger age groups, productive age groups, and so it's not just doesn't have a impact on the individual or the family concerned, but it has a socio-economic impact. So, and all these deaths are preventable. All these deaths due to the NCDs, as we call them, are preventable, and we must. There's no option. We don't have enough money to treat all the people who land up with NCDs in any of the economies in the world. So preventive healthcare is a must, and we need to focus on that. And I think COVID has only taught us how the importance of preventive healthcare. We never bothered about it. All of us said and heard prevention is better than cure, but never has ever have ever we given so much of importance to it. Because of a small RNA particle, we all stayed indoors. We changed the way we are living. We changed our living habits. We changed our lifestyles, all towards preventing that infection. So I don't think there's a better time to push the preventive aspect of healthcare and make sure that it becomes a very important part of the armamentarium of the healthcare system. The second P, which is going to become a part of the healthcare, which if it is already not a part of healthcare, is personalized healthcare. No two individuals are different, and no two individuals respond in the same manner to the same treatment. For example, a patient with, let's say, a breast cancer, unless you go to the genetic to the genetic root cause, you would not be able to understand the best form of treatment that is for that particular individual. So we've now started to begin to understand the disease at the genetic and the molecular level. So that gives us an opportunity to find solutions which are really personalized, which are best for that particular individual. And this is only going to grow in the future. So personalized healthcare is going to be the second P. The third P is proactive. A lot of us would, at least in India, would see people coming into hospitals in stage 3, stage 4 carcinoma, which could not be treated, where palliative care was the only option. But now we're beginning to see people coming in much earlier, with the palliative care is reserved, not as much as it used to be in the past, the starting of the treatment. So we are going to see a lot more of proactive care in the country, both from the providers and also from the people who are becoming more conscious about their health, and who are also having this wonderful internet to get good or bad information, but they're getting a lot more information about health, and so they are going to become more proactive. The next thing is the next P, the fourth P is precision medicine. A lot of things have become more precise. In the past, we used to, for example, to continue with the example of cancer, we used to have a cobalt machine, which not only used to burn the tumor, but burn everything around the tumor. Then now we're getting into more precise. We've got a proton today, for example, which is a 1200 crore project in India. And that has such a precision that it doesn't touch a millimeter beyond the tumor tissue. So precision medicine, whether it is radiation, whether it is minimally invasive, whether it is robotic surgery, precision medicine is going to become the in thing in the future. And a lot more of it is going to be seen as we move ahead into the future years. Another P, which is very important, the last P, is the public private partnerships. Nothing is going to happen as we are seeing in the current COVID situation. The government can lay down any regulations, the government can do what it wants to, but unless the public, the people are involved into it, it's not going to happen. The outcomes are not going to be great. So I think the people are one of the most important things that is going to happen in the future is we're going to see more empowered patients, patients with more knowledge, patients who know much more than what we think they do know, and they are going to become a part of the treatment. They're going to be partners of treatment rather than recipients of treatment. So that's going to be a huge change that we're going to see in the future. And having spoken about the five P's which will take us into the future, the last thing which I would just touch upon is my passion, my favorite, which is emergency medicine. About in the late 1990s, we never had emergency medicine in this country, in India. It was all about casualties, which used to be a room in the hospital, and the worst doctors and nurses used to be posted in the casualty. I remember very well, and that used to be like a post office where an emergency used to come in, and if it was a cardiac emergency, the cardiologist used to be called in. If it was a neuro emergency, a neurologist, neurosurgeon used to be called in. So it used to work as a post office. But I think we've evolved in a big way, and this pandemic has actually demonstrated what a true emergency service can do, right from the transporting the critically ill patient to resuscitating them to stabilizing them to taking care of them. They have been at the forefront of it, and it gives me immense pride to see how emergency medicine has evolved in this country. Having hosted the first ever conference of emergency medicine in India in 1996 in Hyderabad, it gives me immense pride to understand and see the growth of emergency medicine. We still have a long way to go, and I think we're moving in the right direction. With that as a platform, I would now request Professor Y.K. Gupta to take on and talk to us. Dr. Gupta?
Nothing is not there.
Okay, then we'll move on. Can I ask Dr. Sergey Suchkov to please take it over, please?